Hello everyone, my name is Zamri Rushikesh Shankar and today topic for daily task is the introduction of medical coding. We all know that medical coding is the main role now in a hospital because ensuring the claim and reimbursement purpose. The medical coding is a procedure or the practice in which the conversion of the diagnostics procedure and surgical procedure which are performed on the patient which will be converted into the alpha numerical codes. These alpha numerical codes which are universally accepted. Uh, this is known as the medical coding. The the main role of the medical coder is the achieving of the main role of the medical coder is the billing and reimbursement. The Now, what is the purpose of the medical coding? The medical coding has several critical purposes. The first of all, insurance reimbursement. In that, to ensure the healthcare provider are properly compensated for their services. In that, to produce the claim to the patient. Then data accuracy, provide a standard way to record patient information for the future reference and research. In that, to maintain the accurate data which will be useful for the patient and for the reimbursement. Then regulatory compliances. The regulatory compliances ensure the healthcare facilities comply with the legal and regulatory requirements. This is about the regulatory compliances. Then the public health research enable the statistical analysis of diseases, treatment outcomes, and healthcare trends. These are the several sources of the medical coding. Then, what is the key components of the medical coding? The several key components of the medical coding. First of all, what is the medical records? In the first, it is the medical records. The coder extract information from the patient previous records or such as the physician notes, lab results, and imagination reports. Then the code sets. The coders are specified standard code system. There are generally three types of coder system which are used. That is the CPT. The CPT is the current procedural terminology. Then the ICD, it is a international classification of disease, and the SCP, HCP, CS, healthcare common procedure coding system. First of all, in ICD, the ICD is used to documentation, diagnosis, and health condition. Then what is the CPD? CPD is used to code the medical procedure and services. Then SCP, CS, that is include the codes for non-physician services, medical equipment, and the supplies. In that, what are the medical equipments which are usually during the surgeries? That are comes in the SCP, MS. Then how medical coding works? The medical coding works by the following points. That are, first of all, in the review of patient record, the coders carefully examine the documentation provided by the healthcare providers. Then second is identify the key information. The exact diagnosis procedure and other relevant details are involved in the identify the key information. Then assign the codes. uh, match exact code which should be uh, similar to the appropriate codes from the standard code sets. Then submit claims. Codes are entered into the billing system, generate claim for the submission to insurance companies. Then the types of medical coding. In that, first of all, the diagnosis codes including the patient condition of diseases. For example, ICD-10 codes. Then procedural codes. Procedural codes represents the specific treatment of the services. Example, CPT codes. Then drug codes. The drug codes are medications classified as the medications. Drug codes are classified as the medications used for the treatment of the diseases. These are and then the importance of accuracy. The first of all, the importance of the medical coding is the claim rejection or drains from the insurance companies. Then second, the legal issue or addict for the uh, for the fraudulent billing. Then the misrepresentation of the patient health data. The medical coding certificates, in that the CPC certificate, it is certified professional coding by the AAPC, then the CCA, the Certified Coding Associate by AHIMA, then CCS, Certified Coding Specialist by AHIMA. This is about the introduction of the medical coding. Thank you.